some days are going to be hard. Some days are going to be easy. And some days you're going to screw up. Some days you're going to fail. And some days you're going to knock it out of the park and be very successful. And in all days, you're still you, right? Give yourself grace. Put yourself out there. Keep doing the hard work. Just wake up each day. And that day decide you're going to wake up and hit the ground running.
Hello, everybody, and welcome to Talking Health with Health Solutions. This podcast is being recorded at Health Solutions, a nonprofit behavioral and physical organization that has been serving the Pueblo and surrounding areas for over 60 years. And on today's episode, we have Teah Miller. Teah Miller is our Vice President of Specialty Services. Thank you so much for being here with us today, Teah.
Oh, thank you. I'm excited. I'm a little nervous, maybe. I don't know. I don't know what you guys got in store for me.
We've got lots in store for you today,
Okay.
and we're so happy to have you here on our podcast of Talking Health with Health Solutions. My name is Melissa Ayala, and I'm with Nancy Gonzalez today, and I'm going to let her introduce herself.
Hello, everybody. My name is Nancy Gonzalez, and I am the Suicide Prevention Coordinator and working as well towards my licensure. So thank you so much for being here with us today.
Yeah, we're super excited to have Nancy join us in the fold with her licensure as a licensed clinical social worker. By trade, I am a licensed professional counselor. And Teah, we have you here today, and we want to learn so much more about you. Can you give us a little bit about your background and what brought you to Health Solutions and why we're so lucky to have you here today?
What are the origins of Teah Miller?
Yes.
Well, I don't think we want to go far.
We could be here for a while.
That could be a while. So I'm also a licensed professional counselor. I have been here 19 years this year. I was about to start my 20th year. I was thinking about it the other day because I started at Health Solutions when my youngest child was just 6 weeks old.
Wow.
And so it's easy for me to remember how long I've been here because as my kid is no longer a kid, he's over 18 now, I'm realizing, wow, this is a long time to be
The years
here.
go by so quick.
It does. Like, I remember when you guys started here and just to see where you guys are at too. And I love seeing the growth in the staff and the different directions they take. It's so exciting. Before Health Solutions, I worked in acute care. So I worked in hospital settings.
Wow,
So most of my career has been in either hospital settings or here at Health Solutions.
Before you started at Health Solutions, what is your undergrad in, Teah?
Psychology. I've always known I wanted to do this. I knew when I was still in middle school, I believe, that was the first time I remember thinking that this was actually a real career. And I knew then that my desire was to work in community mental health, not like private care. At one point, there was one small blip in my career when I was in college where I thought about transitioning to nursing, but I almost switched to nursing. But no, I knew from as long as I can remember that this is what I wanted to do, and specifically with the community mental health and working directly in our communities.
I've had the pleasure of working with you since probably I started being the director of crisis. And, so you've been here for, you said going on 19 years? 19 years.
19 years this year.
So you've seen the growth of Health Solutions and you've seen all of the ideas that maybe have sparked up. And I think that one of them has been this podcast that you being there with Melissa, being like those individuals who were part of the initial idea. So how does it feel to see the idea now be a reality and you being here on the podcast?
I don't even know how to say it. It's kind of surreal. I'm almost getting giddy and excited. This is such a cool organization because we have these great ideas. So you think, oh, I want to build this, I want to do that. And it doesn't happen overnight, right? Everything takes time. And then when you see it up and in action and doing the thing, seeing that legacy come to fruition. Like when we built the apartments, I remember when that was just a dream. And then here we are. It's, they've been open for 5 years. And so, and they're very stable. And you see the clients and the things they get because of all that we put together. And then the staff that come in and do the work. It's just really exciting to see.
And you mentioned a lot about like innovation that you've seen over the past 19 to 20 years. And I believe, and you can correct me if I'm wrong, but you started as like a clinician.
Yes.
And moved from a clinician to taking care of the ACT team and supervising them, and then over to crisis and as a director of crisis. So and then now VP of Specialty Services. So you've been a part of a lot of departments here at Health Solutions through your tenure. And so what would you say as far as innovation and through those programs, what has kind of inspired you to keep moving forward as you continue your career?
So I say this all the time. I really love the work we do. I love the staff we work with. I love like seeing Nancy. I remember when you started working at the crisis living room, and look at you now and seeing that growth in our staff. But I also love seeing that growth, that same kind of path that our clients take, where we see them coming in crisis, and then maybe they transition into treatment in Crestone, and you see this growth. And so that growth that we see in the clients and in the staff, that's what I do it for. And then when you talk about like innovation, like thinking of all the different ways that we can fill a gap that is missing, and how can we meet that gap? What are some other ways that we haven't thought of before? And, you see a need, you want to fill the need. Well, I was thinking about this when you were like, oh, we should come on the podcast and talk about your tenure at Health Solutions. Like, when I started here, I was like in my early 20s, and we have staff who are just starting in the early 20s. And then can you imagine 20 years from now what they might be doing?
Right.
And that's what kind of keeps me going. That's the excitement. That's that thinking about 20 years from now, what will it look like? Who's going to be in that vice president seat? And what kind of great things are they going to bring forward that we never thought of before?
Yeah.
That's the fun.
Yeah. Could you imagine a podcast 10 years ago when
never.
you started at Health Solutions?
Never. I remember when it was just like something you talked about. I can't even remember. I think it was either you or Nancy.
It was Nancy,
that's
yeah.
what it was. And we were talking about it, and I was like, that is such a great idea. Mm-hmm. And here we are, right? And so that's what it takes. It takes that person that just has this idea. And like I said, sometimes it's not fast, but you come forward and you're like, hey, what if we did this? And here we are.
And I just kind of want to backtrack a little bit, Teah, because you talked a little bit about the apartments. And for our listeners who maybe don't know what that is, can you tell us a little bit about what these apartments are? Because I think it's an incredible thing that you did with these apartments, but they're not just the apartments. There's so much more. So for our listeners, can you tell them a little bit more about them?
So through the work here at Health Solutions, and like you had said before, I worked in crisis. I worked on the care team. I did a lot of different programs. And the thing that I kept seeing that was hard is that we put in so much energy into our clients. And our clients tried so hard, but they were still dying on the streets. That's the truth. Like so we had this one particular client. It's pretty well known to us. We had a lot of work with them through crisis. They were at the Teah. They were in the care team. And they were being seen on the care team 6 times a day. They were getting med delivery. They were very supported. They were making a lot of progress. And they had a voucher, but no ability to find a place to rent. Right? There's a lot of barriers, some from their own making, some from just the system. There just wasn't the type of apartments that could serve that person, right? Like it just didn't exist in our town.
Yeah.
And so my director at the time and I looked into some trainings. We did a training on a project called Permanent Supportive Housing, and how if you connected a service provider like Health Solutions with a housing developer, and you had a project designed to meet, your harder to serve persons and teach them how to be a successful tenant, right? Mm-hmm. A lot of people who have been unhoused for many years, they don't know how to go from living on the streets to being a productive tenant. Right. And it creates a lot of challenges. You might get them in a place and you might get them moved in someplace, and then it fails. And then that just kind of reinforces, see, they don't do well.
Yes.
And so it creates this cycle. And you see this happen year over year where they're struggling to stay stably housed. And every time they go through an episode of instability in their housing, it can also then lead to instability in their physical health or their mental health. This particular person also had stage 4 cancer, and every time they lost housing, they did not follow up with their medical care. And what happened is it created this terrible cycle of continuing to decline in health. And so a very treatable medical condition turned into a terminal illness for her. Because if it could have been caught sooner, if it could have been done this, but it just did not work out for this person. Finally, like after a year, it took us a year to find a unit that she could move into, and unfortunately, she passed on the same day that she could have moved in. Her lease-up day would have been that day. And so when we were looking at like, how do we help these people? Like, this is a gap. This is a gap in our community. What do we need? And that's when we built The Right Place. And The Right Place is actually named after a poem this person wrote. This person wrote a poem about like, why is there not a right place for me? Why does this why does it not fit? Why do I not fit in any of these places? And now that poem is in the apartment. So if you ever go to the apartment building, in the front lobby is a picture of this person with her poem and then a letter to her father that the family had put together for us in the opening of this apartment. And so that's really what it's about. It's about serving those individuals that otherwise would not have been served. Because she easily could have gotten the medical care and the treatment she needed had she, had a safe, stable place to live. If you think about it, those of us who have safe housing, we don't think about, it's Tuesday, I have to go to the doctor's appointment. But if you're on the streets, you don't think, today's Tuesday, I need to go to my doctor's appointment. Like, that's not
like
your
those
first
needs,
thought.
right? Those Maslow's hierarchy of needs. You got to have your basic needs met.
Yeah, I mean, you're going to shelter and food. If you don't have those things, you're not going to think about all the other things, like making sure you get your regular health screenings. You don't think about those things.
Yeah.
And so that's really what that was about. And like I said, it's been open for 5 years. It does very well. The staff that we have that work with those tenants do an amazing job. And everyone that's there, they are now having access to treatment that they normally would not have had. Or if they had it, it would have been much harder because back to like, why would I worry about my appointment at Health Solutions on Tuesday, right? So we're very excited about that.
Yeah. It's something that I've heard about, and I didn't know that there was a poem though that went with it, and the name of it coming from that poem, and it makes it just have such a much more deeper meaning to these apartments, because it truly is a place for people, like you said, Teah, for them to kind of integrate back into if they wanted to be in the community and rent their place of their own. Because a lot of the times, like you said, people go from being homeless to wanting to get a place of their own, and there's a lot of things that happen in between the middle, so that is really incredible to hear more about the Right Place.
Yeah.
How many people does The Right Place facilitate currently?
So it's a 35-unit apartment, and they all have attached vouchers with them. So it's a subsidized housing. And the way Division of Housing functions is it's 1 bedroom, 2 heartbeats. That's the terminology.
Yeah.
So if there's 1 bedroom, you can have up to 2 people in it. It doesn't always serve 2, but that's the maximum capacity for a 1 bedroom unit is 2 people. So some of them have 2 people in them. Some of them have 1. I don't know exactly the ratio, but it's 35 units and it can serve up to 2 people per unit.
Wow. That's really cool. That's really cool. Earlier, Melissa, you mentioned about the CSU, and I think a lot of our listeners, or at least I've had a lot of people tell me, what is the CSU, and maybe how can our community reach that? What is it like? What does a protocol look like?
We oftentimes in our industry think that our listeners and the people know what all of our acronyms and our different sayings mean. And so through Teah's supervision and through our work, we were able to coordinate with our licensing boards to establish a crisis stabilization unit, which is just like a smaller level of care. It's just like a step down where they are having some thoughts about suicide, or they're having some thoughts about psychosis or whatever it may be that they're experiencing, but they're not a danger to themselves. They're not a danger to others, but they're still not functioning the way we want them to function. So this is where the crisis stabilization unit was able to interject in those lives and provide that service for individuals to meet that need of like, they're not quite meeting that criteria for ATU, but they still need support. And that's what we're here for. And we have the capacity to do that. So it's been really exciting to have the crisis stabilization unit be part of our acute treatment unit. And so far we've been rolling with it.
Yeah. Yeah. And that's, again, one of those things like there's this gap. There's this, okay, a person is in outpatient care or there's ATU, but what about that gap in the middle? And we need, we are always looking at what's the gap. What are the people we are not serving? And that was a gap, we need something that's a little lower level of care. Maybe they don't need to be court ordered. Maybe they, and if we can intervene early, like that's the other thing. Like, what about prevention? Like, can we get in earlier and stop it from escalating and getting to a more serious crisis? So that's really exciting with the CSU addition.
And I think too, one of the things that's been really special about it, like you mentioned, Teah, is like, where are our gaps?
Yeah.
And Health Solutions has done over the past 20 years, I imagine.
Or at least more. I mean,
if not more. Yeah. I mean, what have we been here? 60 years, you mentioned, Nancy? Like over that period of time, we continue every day, if not every week, identifying, we have a gap here. What do we do? How do we fix it? And it's not this, oh, man, we don't know what to do, or we can't fix this, or this is just what it is.
Oh, yeah, I don't like that. I believe, like, that's why I always say, it's like if plan A doesn't work, like, let's move to plan B, let's move to plan C. That's why there's, like, all the different letters of the alphabet. There's always a solution. If there's a gap, if there's a problem, then, like, we need to find the answer.
Teah and I joke all the time with each other because we're like, let's just go. Like, we don't know. Like, we're just going to build the plane as we're flying it in the air, and we'll figure it out.
Yeah.
And so sometimes we have to check ourselves. She checks
we don't want to
me
crash and burn. You're right. And we do joke around it all the time. Like if it wasn't, we have to say, okay, no, Melissa, did we think of everything?
Yeah.
Did we think of everything? Like, do we need to slow down a little bit? Because there's this just a strong desire to fill that gap and do the thing. And so it is important to make sure we think about it.
Yeah. Dr. Baldridge mentioned earlier in a podcast that we did, to what end? Like,
oh, sure.
And I just value that so much because it's truly like, what is the goal here?
Right.
And sometimes you have to step yourself out of that to identify like, what is our end goal here, and how do we make sure we get that
hit that target?
Yeah,
exactly.
Yeah. I think sometimes you just have to go with it too and have like that, not be afraid of making that mistake. And I've always said that too, is that, if you're afraid, you're always just going to stay there because you're afraid. But I think that the way that you guys are taking this of just like going with the flow of things, I mean, if it doesn't work out, like you said, Teah, you guys will learn something from it. And I'm sure you guys are going to correct it in that process. So
to be honest, I think many times we learn more from our failures than our successes.
Absolutely.
If you think about it, if you think back through your life and all the times you failed, you realize, okay, now I know I can't do it that way. Yeah. But when you succeed, you just are so busy like congratulating yourself that you don't realize like, hey, like I what did you learn from that? Like, what did you learn?
Yeah.
But we do learn from our failures sometimes.
Absolutely.
And at the end, and to what end, right? Obviously, our goal is to provide the best, most excellent care for our clients and our communities we can.
Yeah.
And as long as that's our mission and that's our goal, then that we keep moving towards that direction. Through any failure, through any bumps, through all the red tape that sometimes comes with the job, that's the goal. You have to shoot for that target.
For our listeners, Teah and Melissa, who maybe don't know how to access these services, how can somebody from our community access if they are like, hey, the CSU sounds like something my family member can benefit from? Where can they access these services? Who do they go to?
The easiest way is through crisis services. At Crisis, we have a walk-in center, so they can walk in with a self-defined crisis. They come in, and whatever their crisis is, the team there can facilitate connecting them to services all the way across the continuum of care. And we believe in meeting a person wherever they are at. If where they're at is on the side of the road, that's where we'll meet them at, right? So if for whatever reason they don't want to walk over to the crisis living room off of Chinook, then we will go to them wherever they are at.
Nice.
And We're always interested, and Melissa and I have talked about this. We're always open to, like, maybe there's a doctor's office in town. Like, we can make a direct connection. Like, there's no reason why we have to put in barriers. We constantly are working and talking to our partners about that.
Yeah, and that's where community engagement is so important. And I think Health Solutions has done a phenomenal job in that way of connecting with those stakeholders within the community of how do we make this service as streamlined as possible. Right. Because I think we were talking last week about, like, we all see the same clients. We're all serving the same patients. Yeah. We're all members of the same community. So how do we work together to ensure that clients, patients, community are all taken care of in the best possible way?
Exactly. Yeah, I agree with that. And you're right. We were constantly talking to our community partners because the number one thing is, like, access. When a person wants help, when they're ready and they're interested in help, we need to meet them at that time, because
exactly.
If we don't meet them right then, even a day from now, it could change. Yeah. So we really need to intervene right away. Even with the work you're doing, Nancy, it's so impressive with the suicide prevention work, because it's all about connecting early, right? That early intervention.
Right. Yeah.
The earlier, the better.
I think that now that we're on the topic of crisis, I think maybe just like a brief overview. What is crisis, maybe for our viewers who are kind of listening in?
Crisis is another thing that's, like, always evolving. That was my first job when I came to Health Solutions. My first job was a crisis clinician. Back in those days, there was 5 of us. The whole team was 5 people. I actually think, I keep saying 5, but I think we did have one that worked PRN that helped cover for call-offs and stuff. And back in those days, we mostly served clients that were opened to the agency, right? So we were serving our own clientele. We also did the admissions for the state hospital, because back in those days, there were civil admissions. In fact, I probably was the last crisis clinician to admit somebody in a civil bed at CMHIP, because we had allocated beds for Pueblo County at the institute. And our crisis clinicians were the ones that did those assessments. So that's what we did back in those days. And then over time, there was a lot of evolution with crisis. And now we provide crisis through our 3 counties, Pueblo County, Huerfano County, and Los Animas County, with a mobile crisis response team, as well as our crisis living room. That is a newer innovation here. Well, I say newer. That's even been here since, what,
2015. 2015 has been here for 10 years.
Time does go by now.
Yeah, sure does.
I was like, wow,
man.
That's been some years. And so we are a crisis support team for anybody who needs it. That's why I think I said it earlier on, that it's a self-defined crisis. If they say they're in crisis, we will respond. It doesn't matter if they're a client, it doesn't matter their payment source, it doesn't matter any of those things. If they say they're in crisis, we will respond to that person in crisis. And the answer could be all kinds of things. Like there's different ways we can connect them to care. It doesn't necessarily even mean that they're connected to Care with Health Solutions. It could be that we get them connected to a different organization. And we facilitate that connection. So we will help them get connected to those services
that they need.
Yeah. And so that's what crisis does. We are connected through the 988 system, so the National Crisis Hotline system. So if someone were to call 988 in crisis, they will, of course, be immediately connected to a crisis clinician by phone. And if one of the interventions that person needs is a mobile crisis response, then we'll deploy one of our crisis clinicians to that person's location.
Wow, okay.
And within Pueblo County, we will provide a face-to-face intervention when it's deployed within 1 hour of that deployment.
Wow.
That's mostly because of the travel time, just the time for travel. Frequently, it's much faster, but that's the requirement through the 988 system, that we will get there within 1 hour of that requested deployment.
Wow.
So, the easiest way to reach crisis is through the 988 system or self-referral, where you just walk in, call us directly.
And one of the beauties about crisis services is, yes, that may be one of the worst possible days that you're having, but through that process, you can get connected.
Yes.
And through the services that Health Solutions provides, you're like kind of wrapped around with those services. And so like there's always the next step for you of, yes, this is a really horrible day and experience for you and you're really struggling in a crisis. And here's what we can help you navigate, and here's how it could get better for you. And that's the beauty of it.
Yeah, I agree. And always the goal is to connect to something, right? Whatever that looks like. You're not going to take away everything in that one call. Let's be honest. Like, it's not going to solve all the problems. Yeah. But it might be that first step. It might be that first interaction with somebody that gets you to the next step and then to the next step. I also, I'm a trainer here at Health Solutions. I train ASSIST, which is Applied Suicide Intervention Skills Training. And there's a section in the training where I always talk about like that doing this work, doing crisis work can feel somewhat like overwhelming. Like, well, this person was just here last week. What did I do wrong? Like, why am I not helping? What am I doing that's not working? And I tell them all the time, it's like, no, what you did clearly worked because they're still alive. As long as they're still alive and coming back to you even, not only that they're alive, but whatever you did last time was enough for them to realize I can go back because this person helped me once before. So it's actually a blessing every time they come back to you. So that frequent flyer, that person you see every week, that's great. That's an amazing thing. And so that's what I always tell them during that training. Like this is a great thing. Every time that they made it one more day, you did something right. And then every time you see them, over time, you see the growth over time. Like I said, I've been here 19 years now. You can see that. Looking back, you can see how that one call, like, and I have the stories to share.
I could imagine.
You're like, oh, remember when that happened? And now look at them now, look at how amazing their life is. And it all started from that one moment in crisis, maybe 5 years ago. Maybe it takes 5 years to see that kind of growth. But you do see it, and it's really impressive. And we got to keep that in mind.
I can imagine the number of lives that you've impacted in your tenure of 19, 20 years of doing this work that you've done. I imagine that number is probably more than you even can fathom.
I think what's more important is them, like the work that they put through it.
Yeah.
That was
you were the navigator.
It's like I was the sign on the highway, like pointing the way, but they did the work, so that's pretty exciting to think about.
Like, as you said, they trusted you and you did something that made them feel comfortable to where they're like, I can go back to this person. Right. So it's always nice to be able to tell people that are coming in to assist, like you didn't do nothing wrong. It's actually really good that they did come back to you.
Yeah. Rapport is a beautiful thing.
We'll see somebody and they're like, oh, they're back, but they look better this time than last time. There's something new that's
they've made a step.
They made a step.
Yeah,
exactly.
And I think what you can pick up those two on those individuals that maybe do come more frequently is that you're able to pick up on when they're off. When they tell you that they're okay, but you're just like, this isn't your typical self though. Yeah, what's happening? And so it's really nice, like Melissa, building that report and being able to also see like when they don't identify that there's something wrong with themselves, but you see it as a provider and being like, oh, okay, there's something there. Let's get you to that help that you need. So it's really nice.
Well, I'm sure you've seen it. I mean, Nancy, you've even done the work yourself.
I feel like everybody should work at crisis at one point or in their life.
I say that all the time. Yeah.
Because you really, learn so much from it, but then just the adrenaline that you get from no day being the same. Like every day is so different. True. And there's some days where it's like a little bit calm, and then others days where there's like people in there that are, they're throwing things and you're just like, dang. Yeah. Today went by so quick.
Yeah. And you see it. You can see the change in people, and it's really exciting to watch that.
Yeah. And right before your eyes, it happens in a blink of an eye sometimes.
Exactly. Right.
Yeah. We're so happy to have you here, Teah. We thank you for being here with us today. It's been a wealth of information for not only us, but for our listeners. And so thank you for being part of this. But before we let you go, we have some very, very crucial and important questions that we have to ask all of our guests because like Nancy always says, it either makes you or breaks you. And it depends on how people may view you going forward with these questions.
Especially being the vice president. They're going to be like, that's our vice president? That's what she said to that answer, to that question? So, Not to put too much pressure on you, Teah, but these are some hard questions, so prepare.
Okay, I'm ready for them.
So does pineapple actually belong on pizza?
I 100% think it belongs on pizza. It's like one of my
With
favorite.
spaghetti sauce.
Yes.
Teah, see, and this is why Teah and I get along. This is why I knew Teah. Yep.
Yeah. Fruit belongs on everything. I actually love
We're
fruit.
going to talk about that in supervision.
There's only been one person who has said no, and I think that has been Melissa.
Yes.
For real? You're the only one that says no?
Yeah, I don't. It's slimy.
Well, I know how you eat, Melissa.
That is true. Teah does.
She's a bit of a picky eater.
Yes.
Yeah. I told her the day that she eats salads, I'll know that something's up. And I'm like, what's happening?
If there's any type of vegetable on her plate, like what is wrong with Melissa?
We need to get some
how did
intervention.
this come about me?
I don't know. You said this were high pressure questions. It didn't say it had to be pressure on me.
Yeah. You passed it though, Teah. You passed it, you know,
Perfect.
so that's
I
good.
passed it.
The next one is a hot dog a sandwich?
No.
What is a sandwich?
So I know you're going to say this because it's in between two pieces of bread, but it's not two pieces of bread. The hot dog is a split loaf. So it's more like a hoagie.
This is the most innovative answer we've received
Yeah.
regarding what a
See,
hot dog is.
See, this is my brain. This is
Yeah.
my brain. It's more like a hoagie.
Did you hear that, Dr. Baldridge? Hoagie. It's interesting I say that because we had Dr. Baldridge, and Dr. Baldridge, as he was answering the question, he's like, actually, no, it is a sandwich.
He talked himself right into
Yeah.
it.
He talked himself into it. That's not my style. I'm not
It
gonna be
was so
talked
funny
into
to see his reaction. He's like, "Wait, you know what? I changed my answer."
Last question we have for you, Teah, and this is probably more important for our viewers, for our listeners, because I think there's so much value in the work that you've done for the past 20 years. What is the mental health tip that you live by?
Oh, geez. Some days are going to be hard. Some days are going to be easy. And some days you're going to screw up. Some days you're going to fail. And some days you're going to knock it out of the park and be very successful. And in all days, you're still you, right? Give yourself grace. Put yourself out there. Keep doing the hard work. And some days you're going to nail it.
Yeah.
So just wake up each day, and that day decide you're going to wake up and hit the ground running. Like I think about, you guys know this about me, but like some of the new things I've been trying to do, like push myself to do some 5Ks and stuff. A year ago, I never would have thought that about me. Like this is not who I am. And it wasn't like that happened overnight. It's every day I woke up out of bed, put my feet on the ground, and decided today I was going to try hard today. And so that's what I live by. Like each day, decide for that day that you're going to try hard.
Yeah,
Do the
Absolutely.
thing.
I love that. Again, thank you all for being here. Thank you, Teah, for being here. Nancy, appreciate your support and co-hosting this podcast with me. Appreciate that. Again, we're talking health with Health Solutions. If you or someone you know is struggling with a mental health crisis, please make sure that you reach out to 988 or walk into our crisis center at 1310 Chinook Lane, or you can even contact us directly at 719-545-2746. Again, thank you all for being here, and it's Talking Health with Health Solutions.